our Healthcare for the Homeless program here in Boston has been working hard, sort of at the ground level, to cope with COVID as it's hit the shelters. And as you all know well, we in Boston, about 90% of our adults are in shelters, about 10% are out in the streets, and virtually all of our families are in shelters. So when the virus was coming our way, we panicked a little bit about how virulent it was likely to be inside the closed and crowded shelters. And not surprisingly, about 40% of all the adults living in shelters in Boston came down with COVID. And what we had to realize, come to realize, is we have clinics in about 25, 26 shelters around Boston, most of the adult and family shelters. We have clinics at the hospital, both at Mass General and at Boston Medical Center. And we have a 104-bed respite program which we've been developing for many years with the help of a lot of partners. But we realized we were full and absolutely crazy busy as COVID came on. And then when COVID hit us, we had to completely turn everything upside down, as many of you have done the same. We had no place, for example, to isolate or quarantine people when they were exposed or had the virus. And so I remember our staff, who have been unbelievably wonderful, and I can't believe they still have any energy left at all. We put up tents for quarantining. The mayor helped us get extra places so that the shelters, who have been great partners, were able to go from 500 or 600 people down to 200 people to make sure that the virus, they could do some distancing. And then we also opened a hospital with the help of Mass General. Brigham opened, and the mayor opened the Boston Convention Center. We had 500 beds aside and right next to a 500-bed hospital run by Mass General, where we could take people with COVID who from the shelters or who were living in very poor situations. So that was the original thing back in March, in April and May. And we were pretty overwhelmed. But thankfully that first wave went away, and we had a somewhat quiet summer. And then in the fall, it all came back again.